back, I believe it was 2001 when Dr. Engel and myself started dental school. At the time I was interested in orthodontics. Dr. Engel still didn't know exactly what specialty he was looking forward to going into. And I said to him, we're gonna work together. And at the time he said, no, we're not gonna work together. In fact, I believe he even made a bet with me saying, no, I bet you we're not gonna work together. So somewhere he owes me a lot of money. But when we graduated from University of Medicine and Dentistry of New Jersey, which is now Rutgers Dental School, he ended up going to Montefiore Medical Center to do a specialty in pediatric dentistry, and I went off to Columbia University to do my specialty in orthodontics. During our 2 years of specialty training, we kept in contact, and at about year one, when year one was ending, and I knew that I only had a year left, and then we had to get out into the real world and decide what we were gonna be doing, I contacted him and I said, hey, would you consider opening up a practice? And we can do a pediatric dentistry and orthodontic practice together. They really, really go well hand in hand. And the feeling was that as he developed these kids into mature dental patients, what was the next step? The next step would be for them to seek out the care and the trust of an orthodontist. It's really, really been a great mix where Dr. Engel has really kept his mindfulness of the orthodontic component of the practice and then handed them off to our side at the proper time so that they can be treated properly. Sometimes a little bit earlier so we can prophylactically take care of things ahead of time so that they don't go out of control, and other times at the proper time when their dental situation has matured enough where it's prepared for orthodontics or ready for orthodontics. As we were developing the orthodontic side of KinderSmiles, what I realized was that a huge component of what I love doing was really not just treating adolescents and not just treating kids, but treating adults. I had a passion in areas where a lot of other orthodontists tend to avoid, and that is adult orthodontic treatment. And I always tended to want to try to give everybody out there a fantastic smile. And that doesn't just mean the 7-year-old or the 14-year-old, but really anybody. And we saw more and more often not just patients themselves coming in asking us about their smile, but moms and dads and adults that were asking us if there's anything we can do. And early on, when we would show them not just braces, but even clear braces, they would say, oh, I'm not gonna be able to wear something like that. I don't wanna look like I'm 16 years old and then have to do a huge presentation at work. And so we started treating patients with Invisalign. We started treating patients with lingual orthodontics, which are braces behind the teeth. And we were finding that it was working out really, really well. We were able to give these adult patients the smiles that they wanted, and at the same time do it in a way that actually kept them happy the entire treatment, where they didn't have braces necessarily on the outside of their teeth.